Hello, I am Katherine Heiser. I'm a Postmaster's FNP student at Robert Wesleyan University. I have found the clinical concern to discuss today is related to domestic violence and the vital assessments for traumatic brain injury assaults. Um, to understand a little more, according to the Office of Women Health, domestic violence includes physical, sexual, financial, spiritual, emotional abuse, as well as sexual coercion and stalking by a current or former intimate partner. Intimate partner violence is domestic violence when a person with whom you've had a closer personal sex relationship abuses you. Intimate partner violence affects millions of women each year, including men, in the United States, and impacts all social economic levels, ethnicities, races, and genders. So, just a little background, domestic violence is a pandemic. It is a public health problem that is preventable, and over the past 30, 40 years, we're starting to learn more and more about the impact on health and wellness within the community, among our patients. About 75% of female survivors and 48% of male survivors experience some form of injury related to domestic violence. Domestic violence can also result in death, where we're starting to see increased numbers, especially post-pandemic. The cost of intimate partner violence or domestic violence exceeds $5.8 billion dollars each year, 4.1 billion of which is for direct medical and mental health services. There are about 16,800 homicides and 2.2 million worth of medically treated injuries due to intimate partner violence annually, with a cost of 37 billion with recent assessments. So there's an estimated of 1.3 million women who are victims of physical assault by an intimate partner each year, and a good percentage of these individuals have suffered some form of traumatic brain injury that could have been prevented or caught early with interventions. So historically, females have been most often victimized by someone they knew, and usually females who are the age 20 to 24, but also age 44 and under are a common age range to really look for domestic violence and potential for traumatic brain injury. Most cases of domestic violence are never reported to police, so a lot of times they're caught when they come for primary care, or they're coming in for other illnesses or concerns for health care, or even in the emergency department. According to the Bureau of Justice Statistics, on average, more than 3 women and 1 man are murdered by their intimate partners in this country every day. And as we see here on our infographic, about 1 in 3 women and 1 in 4 men report having experienced severe physical violence from an intimate partner in their lifetime. And this is coming from data between around 2020, 2022. And they're noticing that these numbers are starting to change post-pandemic. During the pandemic, the numbers of is more like 1 to 2 and 1 to 3 now. About 1 in 5 women and 1 in 13 men have experienced contact sexual violence by an intimate partner, and 14% of women and 5% of men report having been stalked by their intimate partner. Over 61 million women and 53 million men have experienced psychological aggression by an intimate partner in their lifetime. So, looking a little more locally in our area, which is quite concerning, we actually have about 1.4 times more calls in Monroe County than any other county in New York State. And we are excluding New York City because their provinces and their jurisdiction is a little different. 2.7 times more calls in the city of Rochester than any other city in New York State. So we have a very serious pandemic, a very serious public health problem right here in our community of Monroe County that needs to be addressed. And 75% of women, like I said, and 48% of men survivors experience some form of injury related to domestic violence. So it is these numbers are not getting better, and we're looking that there's more interventions that can be involved. Right now, I know if you go to a for women's health and they ask you, do you feel safe at home? A lot of times there's not an interaction of eye contact, the building of a rapport for the individual to feel trust, to be able to speak up that they have concerns of being safe at home because they're in a domestic situation. So my clinical concern is we are finding a lot of the assessments that let us know that there's potential for traumatic brain injuries being missed in the primary care offices and also in the emergency departments and other clinical areas. My clinical area of focus for practice is working with Willow domestic violence and working with families who have been displaced because of domestic violence who are needing primary care services. So that's why this is a clinical concern that I take really dear to heart to focus on. And TBI is one of the leading causes of death for Americans under the age of 44 years of age. And some of the concerns with TBI is decreased cognitive function, PTSD, memory loss. And some things you'll notice a person has a hard time remembering things. Their performance at work will start to decline. A lot of times you'll think there's other psychological issues that are going on. And in this case, with the TBI versus it being with the car accident or some other kind of injury, a lot of times a traumatic brain injury that is from domestic violence involves with strangulation, asphyxiation from violent acts that are more than once. It tends to be repeated occurrences. So we have this repeated deprivation of oxygen to the brain that's causing repeated injury over and over. And a lot of times there's some symptoms, signs and symptoms that can be caught early when you're in the emergency department or if the person comes for primary care services. So 72% are not identified with TBI in the ED or primary care office of those who are being seen for domestic violence or other care. So that's very concerning that these individuals are walking around, and some people can end up having a stroke and even die from traumatic brain injury from domestic violence assaults. So a lot of time this is due to a lack of training in identifying certain signs and symptoms that should be alerting the provider, such as a family nurse practitioner in practice, that, hey, there is something that's not right here. We need to further evaluate this, provide some support to the person who's been victimized to make sure we don't have ongoing injury or further complications. Many patients will have other signs and symptoms. Um, excuse me. So some of these other signs and symptoms will be poor health. They're very labile. Some people are very canatotic. There's a dissociation where they're kind of very flat, disengaging. They can be restless. You may see there's recurrence or presence of STIs if there's sexual assault, and many other things that are missed during an assessment. So, some very, very pinpoint vital assessments for a family nurse practitioner to assess for TBI damage. Number one is the battle sign. A lot of times we see battle sign if someone was in an accident or if they've hit their head, but the battle sign is when you see the bruising behind the ears, okay? It can be very small, very subtle. Sometimes you may also notice it around the eyes. But if you see these bruises, this should be a very, very big red flag if you're suspecting domestic violence as a possibility of a issue with your patient. And sometimes there's a lot of training on how to have those crucial conversations to make a safety plan for your patients, but also to make sure you're taking care of the fact that they could have a potential TBI or a hemorrhage that's occurring from the assault that they may have afflicted or been being afflicted, because remember, it can be occurring more than once and it's repeated injury to their brain. The other one is petechiae around the eye. A lot of times you would just think it's a rash, or sometimes if they're with their abuser or if they're worried about their abuser finding out that they're asking for help, they'll say they used a new face cream. But this should really be a red flag if you see these petechiae specifically around the eyes and you see other signs and symptoms that make you wonder about domestic violence being a factor. And the other one, the third one that is another telltale sign that we miss in assessment is purpura and petechiae in the eye. I've actually have witnessed all three of these in my clinical practice. I've seen it when I worked in med surg. I've seen women come in for different procedures, and it never clicked on me until now that, oh my gosh, I actually had, patients who actually showed some signs of domestic violence with their behavior behavior, their demeanor, their psychological well-being, and then seeing some of these things. And they came up with some of the excuses that were very convincing when really they were actually in crisis and potentially had a TBI, especially when they were very forgetful and they couldn't recall a lot of information. Now, strangulation is an alarming common part of domestic violence, but also it can be very debilitating. These are some signs and symptoms that you would see of strangulation. As you see, some of the signs are the things you would see, and some of the symptoms are more not as subtle, but things like loss of memory, behavioral changes, loss of sensation, weakness, their speech is off, dizziness, headache, GI upset, difficulty breathing, respiratory distress. It could be also from their airway, if they were being strangled, or asphyxiation, trouble swallowing, painful swallowing, having a hard time clearing their throat. And you actually can notice that when you're talking with your patient, and as they're talking to you, you can see some of these symptoms, even though you may not see bruises or the petechiae or the purpura or the battle signs. This is a sign that that could be recurring abuse that we could be missing with our patient. So please keep in mind, when it comes to these patients, it does take a certain approach to build a comfort of making them feel safe to communicate, but do understand that a lot of times strangulation will lead to death. It leads to a form of homicide. And there were over 50,000 domestic calls in Monroe County in 2022. And we also have seen 4,021 petitions for orders of protection. Out of those orders of protection, only 911 of those orders became granted, which means that we're going to see more of these type of patients coming through our practice in primary care and through women's health. And we have to take a little more time than just 30 seconds of saying, do you feel safe at home? I think we need to pay attention a little more to the signs and symptoms of our patients, and making sure we're providing interventions in a timely manner. Um, so keep in mind also that these individuals have children, and a lot of times if you're seeing this in your patient in women's health or in primary care, it potentially is also being inflicted on children. So then you are a mandated reporter, and you would also see some very similar signs and symptoms in children when they have an abuser and it's domestic violence and they're possibly being victimized with strangulation. And the same thing can happen with a child. Anybody with TBI, it is brain damage. And a lot of times it's not reversible, but we can prevent it. Okay. All right. Well, thank you so much for listening to my presentation. And if you have any other questions, feel free to contact me. I also left on here the 24-hour hotline and text line if you know anybody who is a potential victim of domestic violence, or you want to know how to help, or as a provider, you're looking for resources, you can call these numbers and they can direct you so that way you can support and stop this pandemic of domestic violence in our community. Thank you and have a good day.